Welcome to Healthcare Algorhythm. I'm Dr. Will Strimel. If you want the real story behind today's healthcare challenges and the strategies and technologies people are actually using to solve them, you're in the right place. Short conversations, clear insights, practical takeaways. Let's get into it. Hello again, everyone. Welcome back to Healthcare Algorhythm. This is Dr. Will Strimel, and today I'm joined by Nita Akoh. She's a CEO and founder of MyAtlas, which is a company that is leveraging technology to bridge the gap in accessing mental health care. Nita, welcome. Thanks for making time for us today.
Thank you so much for having me here. It's such a pleasure, Dr. William.
Absolutely. So I want to start with a quote that I pulled of yours to just frame our discussion because it really impacted me. And this is where we're going to get today. And it was that when you were speaking about MyAtlas, in just 5 months, we prevented 8,000 crises from escalating into near fatal mental health events. That's really powerful. So I definitely want to learn how you're doing that. Take me back to how you got started. You know, you're a neuroscientist by training. Tell me a little bit about your journey and what brought you to the problem that you're solving today.
Oh my God. I love that you pulled up that quote because it's really important to me. And I think my story would really shine why that was not only a company achievement, it was a personal achievement for me too. So I'll take it really back down to how I grew up. I was born and raised in Nigeria, and I was a quote unquote weird kid. I was very obsessed with the brain, and my parents were like, this kid is like very interesting. But that led me to actually getting an opportunity to have a scholarship. And I went to Canada for high school. And so there I was at the age of 13. I was moving to Canada all alone by myself. And I moved to like a really, really small town in Canada. I was like one of the only Nigerians that was there. So you could imagine it was a very lonely experience. I made a few friends that became like family, but one friend that really made me feel like home, I call her Sophie. And a year later, everything changed when I walked into Sophie's room and I found her dead. She had committed suicide. And I kept on asking myself the question, which everyone who has felt that pain of losing a loved one to suicide or mental health would ask, like, I wish I would have done something sooner. Like, what could I have done?
What did I miss?
Exactly. What did I miss? Could I have done something? And it's that guilt, like the survivor's guilt. And that is really what took me to study neuroscience. Because my whole thing was, I want to be able to stop, this like pain of humanity. Like, what would take someone there? And so while I was at Northeastern, I worked in a lot of research lab. I worked in consulting. I worked in the clinical system. But I really found myself getting back to that problem, especially because I was working in a hospital and I was in charge of discharge. And I happened to discharge a patient that later on took their own life. And so I was back again to that same problem. And that is when the idea of how can we make sure we never miss someone who is suffering? How can we make sure that nobody ever falls through the crack? And how can we do this in a way that's very easy using devices that is available to every single person, which is the digital phones? And I worked with my now co-founder, who is a renowned professor at Northeastern, and we developed an algorithm that really allows us to use digital data to know when someone is suffering and allows us to route very personalized care to them before a crisis.
Yeah,
And
and we talk a lot about personalized medicine and precision medicine, and nowhere, I think, in healthcare is the disease state, so to speak, that we're dealing with more personalized than mental health. However, when you look at the tools that we have to actually objectively assess it, they're really lacking. I mean, you can't draw a blood test to determine someone's anxiety level. You can't take in, well, we're going to talk about it. Historically, you can't take an x-ray or take an image to understand what a person's mood is. So, there's a real gap here, and I'm sure that you're identifying it. And I would love for you to talk about functional MRI because I bet most people don't even really know anything about it. I didn't know much about it through most of my training till a few years ago when I got a little bit more involved in this and sent some personal patients to the Amen clinics, and they do a lot of functional MRI. But if you could break that down, for the novice about what functional MRI is and what it allows us to see, and by that guide therapy.
Yeah, I mean, the work of fMRI has really changed the game. And the way I would explain it to a novice is the way we know a part of the brain is working is by how much blood flows to that part of the brain. And so you can know that a certain part of your brain is working when you are doing math because you're doing math and your brain needs energy to really spruce up the part of the brain that would really help you function in math. And using that, we created the fMRI where we can see when there's a blood flow to a particular area of the brain. And this, interestingly, also tells us in different states of being, it tells us how a person's brain is functioning. And when you look at somebody who is neurotypical, who doesn't have any mental health disorders, you can see a neurotypical brain functioning where the person is at rest and their brain is at rest, but when you have someone with depression, you find that there are certain brain areas that are over functioning. One of them being the default mode network, which is the part of our brain that makes us ruminate about things on and
Right.
on again. And it really allows us understand how people are, first of all, understand that depression is not just a thing that's in the mind. It's something that you can actually see through
Oh, it's a
measurement.
biochemical process, right?
Oh yeah. Oh yeah.
Yeah, so then the implication there is when you can compare pictures of people with what we understand as normal or at least typical, what most of the population has at rest, who don't have mental health complaints. And then you can compare those pictures to someone who has these symptoms and identify different patterns and then especially when you know, hey, here's a consistent pattern that lights up or doesn't light up depending on the way you're looking at it. Now it really puts you into a group of people that you can then perhaps target therapy around. So then how do you take that next step? How does that help you target therapy?
You know, and this is amazing because one of the best work I've done was develop games where we would actually have the patients in the fMRI and we would use games that would change their brain states that would literally induce mindfulness just through games. And we would see that their default mode network was actually having a reduction in activity. And the more we were able to guide them through mindfulness by games, the more we could see lower activity in the DMN. And we can also tell what types of therapy works for them just by how we see their brain states changing when they're in the, fMRI. And that's also one huge thing in the industry is being able to know when a particular treatment is working. And
Right.
FMRI really changes the game.
Yeah, because let's be honest, at least from the pharmacologic treatments of mental health conditions are not easy to take. They're not easy to stick with, and they're very subjective, right? Of course, there's a whole different realm of counseling and cognitive behavioral therapy. There are great things that don't have that. But medicines are hard, and they
Mhm.
cause lots of complications. So it'd be great if we had a tool to at least give some insight. Yeah, you're likely to respond, or yes, we can see evidence that you're responding. So I'm sure people who are hearing this, right, are, well, how do I get one? So what's right? This is not something that's out there. Why not?
You know, I mean, it is it is such an interesting field, behavioral health. And luckily, there are researchers that are advocating for more people to get access to tools like fMRI based, therapy. But one thing is, it is really expensive. And the sad thing is, people still see mental health as a nice to have rather than a need to have. And so when we talk about reimbursement of personalized mental health, it's something that is almost the first thing to be taken off the budget, because it's almost seen as a nice to have. And so insurance reimbursement for hyper personalized treatment like this is very low, even though it's very needed and very effective.
Right. I mean, we talk a lot about it, and I think every health system, every payer, it's out there, but it seems as though they're not putting their money where their mouth is. I mean, do you have an insight around that? Is it just that? And I hate to frame it this way, but let's be real, right? We have to solve these things through some sort of economic plan. Is it just that they haven't realized the benefit to the bottom line? Forget about the patient care. Obviously, that's important, what because it would seem to me that effective treatment of mental health is not just doing good by people. I mean, you should be able to do well with it. Health systems should be profitable from doing this well.
This is really tough to say, but the people who are seen to be important to the bottom line are getting the treatment. Like the people who are high net worth individuals and who have access, they do have access to these kind of high and expensive treatment. But sadly, the people who need it the most, and I'm talking about people who are suffering with schizophrenia, who have different, social determinants of health that put them in that
Sure.
situation. They don't have anyone advocating for them because they're not on the good insurance. They're not on the insurance that gets you to the front line of the hospital visit. And what we did when I was working at Northeastern is we were trying to reach a lot of these individuals, but there's so many things, there's so many complications in really trying to provide care to those individuals. And a lot of the things insurance loves to do is slap on pills. They just want it to be easy, fixed, assured, but they don't want to take a chance in something that is needs more time in the hospital or needs more time in an MRI machine. So I really would say that is it.
Yeah, I see, right? Because it's an investment.
Mhm.
It's an investment. And so, look, you can't even get the care if you can't access it from the front door. And I think that's what you're really trying to work on with MyAtlas. So tell me a little bit about that and the problem you're solving and how you've gone about creating it.
You know, one of the things when I was working with the fMRI is the data we're able to get just from that interaction. And what we've done is model those kind of data vectors through the data we get through a phone. So through a phone, we can see things like your heart rate, your pulse information, and just the same way an fMRI is able to give you like a footprint of what is going on in the brain, that is also how our digital data is able to give us that footprint. This way, it is more accessible to everyone and it doesn't necessitate you to have to stay in an fMRI machine, for
Okay.
a long amount of time. And using that data and data on who the person is, where they come from, how they feel about life, how they navigate life, we're able to give really, really precise recommendations and advice about care and just like personal well-being.
So it's simply just the phone? I mean, is there another device that someone wears? Like, what I'm thinking about is like an Aura ring. Many people have heard of those or you like love those. Is it pulling that type of data or it's simply just monitoring things that your cell phone would get off you?
So, because access has really been the kind of thing we're chasing, we work with just a phone. But however, if the person does have additional data, like an Aura Ring or like an Apple Watch, we are able to use that data. More data is key. However, with just a phone, a smartphone, it could be a smartphone made in 2012. My Atlas can help the person. And that is where we have tried to really push for what we've tried to push for. We don't want to make a device that someone has to buy. Again,
Right.
we want to work with any device you have.
And so what were like the initial indications that gave you, hey, we might have something here? What made you think you could even go this route? Was there some early data comparing, say, heart rate to functional MRI? Or, how'd you get on the path?
So I have two stories. I have one that is a bit funny because it talks about my personal experience. So my co-founder really is the architect of data. She is really well renowned in the sleep science, digital health field, and she actually came up with an algorithm way before we met to be able to predict mental health decline with sleep data. And so when she's amazing, and when we met we were kind of running the data points on like an N of one data set, like let's just test it on ourselves. And
Sure.
I remember when this was happening, I was like still in college actually. And so I was having the typical college lifestyle of not really sleeping. And we had the data running in that background. And I remember Artie calls me up. She's like, Nita, what is going on? You need to, what is going on with you? Like, everything is showing that you're not really taking care of yourself right now. What is happening? And I was like, okay, this, this is correct. This is right. It was able to catch me. And
I would have freaked you out a little bit, I would imagine.
yeah, I was like, Hi, Artie. Thank you. Thank you for checking up on me. The next step was to run this on people with different backgrounds and really being able to understand that stress and mental health looks different for different people. So the data we would look for when we are looking at a college student is very different from the data points we would look at when we're looking for parents or young adults in the workplace, and being able to understand how to read the data of different populations is what we have excelled at, and we have done multiple studies, and currently we're actually working with the Mayo Clinic Accelerate platform program to really validate and refine our algorithms to be smarter and better at detecting mental health risk.
And do you use the functional MRI as the baseline, or I should say the reference? So you're comparing it back to fMRI?
Yes, we use it as the reference.
Okay, got it. And how many data points do you have integrated so far?
So right now we have integrated about 15 data points spanning from data on your phone, data on wearables, and recently data from EMRs. And so being able to even use the information that is in the electronic medical records of a patient to really bring this full circle and help clinicians as well treat their patients.
And so how do you do that?
So we integrate directly into the EMR, and this is really work that we are very thankful for the Mayo Clinic and supporting our ability to do that. So we've been able to integrate into the Mayo Clinic, platform and really
Okay.
run studies that allow us, first of all, allow clinicians know when their patients are doing better, worse, or which patients need more care and assistance.
Now, have you met any resistance or concerns by patients about aggregating this data or pulling this data or sharing it?
That is interesting because initially it is something that we thought would be, like some a barrier. But you talk to somebody who is suffering and you tell them, we want to help you. And that really changes the conversation. And in this society where Facebook is using your data to sell you ads, this is a situation where we want to use your data to help you. And then there's other things like having the person feel like they still have ownership of the data. And so we have different features that make our patients really know that they have full ownership and autonomy. So they can delete their data from the app. And working with clinics, we're not able to have any patient information come to the back end. And so we don't know who is using the app or what their data looks like. It's completely anonymous,
Completely
from our.
de-identified. All right, so, people have their phones, and you have some variables, so maybe some wearables, some EMR, you have these people who are out there, and they're being more or less monitored, and now take me into that quote that we started with, because that's a big number and that's a big impact. So, how did you determine that? And what did that look like? When did you realize, "Hey, we now not only do we have all this information, we just made a real impact."
Oh my God. So a lot of the things we're able to do with the remote patient monitoring that we enable is, let's say we have a veteran who just came out of, the hospital 2 weeks ago. The first week they're doing fine. The second week they haven't slept, they haven't left their house. And we noticed that on day 9, it is 2 a.m. and they're still awake. Their activity is still high. They have high stress. What we're able to do is use the information we have about that veteran is to call services, integrated behavioral health services, to actually either call the patient, and if the patient doesn't respond or we actually see that there is higher risk, actually have an in-home visit of that patient. And 8,000 times we've been able to either reach a patient where they confirmed that they were at the verge of mental health risk, or in some
Wow.
cases, we've been able to actually have a home visit and intervene with that patient.
That's amazing. And who is the first point of recognition of that information? Is this do you have a central office that monitors this, or is it because and the reason I ask, well, twofold. I want to hear how you guys are doing that. But I know one of the concerns about the home health movement has been from the physician clinician side is that, listen, I'm already inundated with data. I don't know if I have the time and the capability, and I feel a little bit like uncomfortable that all this data is coming in. And I could think this would be a real high risk thing, right? This data is coming in that someone's in crisis. Who's there to act on it?
And One of the problems with the healthcare system is there's actually a lot of agencies that are focused on aiding patients in times when their clinics are not there. But the problem is the clinics and those agencies or community healthcare clinics don't talk to each other. We allow them actually talk to each other. So in many times we've partnered with a lot of independent agencies or even federally qualified community health clinics that allow us actually use them. Like in Boston, for example, we have an agency, Behavioral Health Boston, where they almost act like 999, where they can do like an in-home visit. So we partner with agencies like that to intervene in cases where the
Okay.
clinician is not, awake or
And where are you operating right now?
right now, we're operating mainly in New England. We are about to expand our operations to the great state of California. And so the thing is, we operate with clinics directly, but we also operate direct to consumer where anyone can be able to have their data work for them, get recommendations, go through the curriculums in the app that are really crafted for the person. But when we are working with more acute cases, we do like to partner with clinics.
Okay. Now, take a step back and look at the mental health by technology landscape right now. This is obviously something you're focused on. What are the other big areas that are out there? What should people be thinking about in terms of if you're a developer or an engineer, you want to kind of move into this space? What are some key things that you feel like are going to be in the next several years the ripest areas for opportunity, for disruption or change? And, along with that, for the leaders, the operators, what kind of technologies are they really looking to bring in?
So, one thing, and as a player in this space, this is something that I may fall faulty to, is there's a lot of different solutions doing amazing things. I think the next big wow in the industry would be either a software connector or a company that is able to unite all those solutions to create one big story, almost like what we've done in the cancer industry, where we have different partners working together to solve for cancer. In the behavioral health space, you have a company that's helping with anorexia and another company that's helping with, overeating disorder. And
Right.
there seems to be a lack of continuity of care and integration of care. So any solution that really works at integrating behavioral health care from the clinical to the patient to the community point of view, I think would, really be a winner.
Do you see anything? Is there a movement out there headed in that direction?
I do see certain movements out there heading in that direction, but where I would see the most need is particularly in the rising cases of gaming addictions. In gaming addictions, I do see a necessary need there right now to see it from the technology point of view, but I also want to see it from the kind of community and population action point of view, because that is something that is actively becoming an area of concern.
It's interesting. I wasn't aware of that. How are you seeing that play out? Or what's kind of raising the red flag on that?
I mean, I think thanks to the rise of social media, the quick hits with TikTok and the quick dopamine, really gambling has taken a new era. And I mean, there was like a 3 month time in Boston where DraftKings was the only ad you would see every single where.
Right.
And now you even see on X, you see DraftKings ad every single where, and it's really prevalent with young men. And as we know, like this is a very interesting time for young men in our society,
Yes. Absolutely.
and they are taking to gambling. They're taking to gambling, and we are seeing the negative aspects of gambling, not only on the people directly involved, but also on their families. And so I think it's an industry that is really underexplored.
Wow. And I would have to imagine, we don't have to go into it, but I bet there's at least emerging data that there's probably functional MRI patterns in individuals who suffer from this, right? Who have similar, who, into similar other types of addictions like drugs and whatnot.
Oh my God. Yes, yes, yes. And this was something that we started to explore in the lab where we actually looked at just the realm of addiction. It really relies on rumination and thinking about the drug, thinking about the gambling, and the inability to shut that part of your brain down, even though it's causing damage to you. And so I think the next wave of innovation would be training and helping people in addiction like gambling that is so easily accessible, helping them shut down stimuli in a way that allows them to still function in their daily life. I think that would be interesting.
Well, this sounds like there's a lot of promise out there, at least because I know we haven't made tons of progress thus far, but with these new technologies, functional MRI, and especially your platform. So tell me how people can access this more. Like, where can the consumer learn more about MyAtlas? What can you tell them more about? Hey, if I have an interest in this type of technology, functional MRIs, who should I talk to? Where should I start? Anything you can do to guide people to take the first step down this path.
And so, if you have an interest in really becoming a better version of yourself in a way that is true to who you are, I would suggest you do look at My Atlas Health. We are available on the App Store. We are available on the Google Play Store, which would be My Atlas Health. And if you love neuroscience or the idea of using innovation to really better yourself or people you care about, I'm more than happy to have people reach out to me directly on LinkedIn, Nita Akoh, or you can also email me, nita.akoh at myatlas-health.com.
Well, Nita, this was a fabulous discussion. I'm really grateful to have the chance to hear and learn more about it and share your story. And thank you so much for the work that you're doing. It's really wonderful.
Thank you so much. Thank you for having me.
Absolutely. And to everyone listening out there, thank you for joining us. I hope we'll see you on our next episode of Healthcare Algorithm. And until then, be well.